Why I schedule food on trips. Interleukin-6, TNA alpha, and brain inflammation. Imagine this day where you are not eating anything that's inflammatory. What are inflammatory foods? Sugar, alcohol, white bread, fried snacks, burgers, so many different things that you're eating every day that are inflammatory. When you do eat inflammatory food, your arteries develop plaque, which is arteriosclerosis, and then there could be plaque instability, which could lead to heart attacks and strokes. I know this because I'm a board-certified family doctor, and I've seen this so much. Also, when you do eat food that's high in inflammation, for example, like sugar, what happens is you just don't feel good. You feel tired, you feel anxious, you feel depressed, and you want more of whatever it is that's not good for you. You want more of that so you can move your life forward. In other words, you could be addicted. I know that I'm a board-certified family doctor, but if you look at my content, I talk about self-hate to self-love, disrespect to respect, acceptance, and not fixing your emotions. When you do these things, you allow the equity in your mind to release, and you're able to do more things that you want to. Imagine that day where you're not eating anything that's inflammatory. You feel lighter, you feel more clear, you feel more conscious, and you're not at risk of having a heart attack or stroke. You don't have to worry about what t-shirt you're gonna put on. You can go anywhere. Imagine that day. Your anxiety will be reduced, your concentration will be increased, and you don't need anybody. You don't need me. You don't need a YouTube video. You don't need a bunch of people. You don't need a community. You don't need a family. You can do this by yourself. And when you do, I like to call it neurochemical consecration, where you take the neurochemicals like dopamine, which you need right away, right, with inflammatory food. You decrease cortisol, you increase oxytocin bond with yourself. Have you heard of these medications, Prozac, SSRIs, selective serotonin reuptake inhibitors? Now, I'm not discrediting their medical benefits. I am a doctor, but you can also feel a lot better without anything, increase your serotonin by keeping a promise that you make to yourself, starting off with 1 second at a time. And when you do these things, you put yourself at decreased risk for everything and increase that's what I call mind hygiene, the writing techniques where you accept whatever it is that you're doing, try not to fix it, and see how you can keep on doing something that you don't want to forward your life. When I quit sugar, you think I wanted to do it? No. Even now, I just want to lie down in bed and eat all day long. That's all I want to do. But I just force myself to go to the gym 1 second at a time, force myself to eat anti-inflammatory food, and not eat inflammatory food more so than actually eating something that's healthy. I would rather just eat nothing that's unhealthy rather than eat a bunch of things that are healthy. And let me show you. So we're going to Aspen to snowboard. Well, we means my dog and I. And here, what I've done, I still plan on it. I still want to buy some chips. I want to buy some snacks like Chex Mix or something. But I don't know if I will. But I just don't want to deny myself of it. But you can see I got some peanuts, avocado, I got hemp seeds, I got a protein shake. I have protein cereal, which may not be the best because there's probably a little bit of inflammation in there. And then chia seeds, hemp seeds, and also I'm bringing broccoli and cucumbers as well. But I'm not going to deny myself of eating. I want to eat Lay's chips. I want to eat Indian fried snacks. I've done videos on this too. I want to eat a burger. I just won't do it because I want to feel good about myself. And here's some medical evidence. Elevated interleukin-6 and TNF-alpha, which is tumor necrosis alpha, are associated with higher baseline cortisol, which increases stress, impaired executive function. I mean, imagine if you just got a bunch of things in your body that you don't want. How are you going to function? Increased anxiety and impulsivity. Oh, I need some ice cream. Oh, I need some chips. Oh, I need some snacks. And when you travel, your cytokines will spike and you have cognitive noise. Maybe I should eat that. Should I do this? Decision fatigue. People will say, well, I'm traveling. No, just try not to make any excuses. Have some respect for your future self and feel better about yourself. And just understand that if you can operate at least 60, 70% of the day like this, you're doing great. I mean, there will be a mind hygiene guide that you can download where you can follow along and write. But just remember, you got to be kind to yourself. If you're taking action steps, not thinking that you don't want to, that's self-compassion, right? That's self-respect. You're doing something that you don't want to. Let's take another example. For many years, if you look at my before and after pictures, I was so big. I was overweight, I was working out, but full of inflammation. Well, what did I do? I would schedule in eating good. I would schedule in eating bad. I would schedule in sugar. I would schedule in trying to not eat sugar. I would maybe pack something like this. Okay, fine, I've packed it. Does that mean I need to eat it? No, maybe not, but at least I'm starting, right? And I don't take any time off of it. That's the big thing with mind hygiene. There is no time off. There's no days off. Try not to judge the day just because it's a holiday or it's a vacation. Try not to judge it as good or bad. And I hope you found value in this video. If you did, subscribe, hit the notification bell. I'll be dropping videos Wednesdays at 4 p.m. Pacific Standard Time on how you can believe in yourself to be your best version.